Nigeria received its first batch of the Oxford AstraZeneca vaccine in the month of March and immediately kicked off the process of vaccinating a part of its population. Now, so far, only about 1% of Nigeria's population have gotten the jab compared to the recommendation by the WHO. That's about 60% to 70% COVID-19 vaccine coverage is required worldwide to control and eventually end the pandemic. This means that Nigeria has a lot to do to ensure that more of its population gets vaccinated. We'll be talking about this. Now, the Presidential Steering Committee on COVID-19 and governors of the North Central region have resolved to intensify sensitization campaigns in communities across the zone to increase the acceptability of the Oxford AstraZeneca COVID-19 vaccine. And as Nigeria expects to receive about 40 million doses of vaccines, distribution, acceptance, and widespread awareness remain critical to the fight against the pandemic. This is what we'll be looking at in the next couple of minutes. Joining me to take a look at this is Dr. Japhet Olugbogi, the Chairman Committee on Infectious Diseases, Nigerian Medical Association, Lagos, and the Medical Officer of Health for Papa Igomu LCDA. It's nice to have you join me, Dr. Olugbogi.
Thank you very much for having me this morning.
Great. Now, when we hear reports of how the penetration and the number of coverage of the vaccination across the world, and we compare that to Nigeria, we see that we're still very far behind somewhere. Now, when it comes to how we're doing it, or how fast we're going, what's your assessment so far?
Well, thank you very much for having me once again. Nigeria is rolling out vaccines, or rolled out vaccines from the 15th of March. We make do with what we have in our stock, which is the 3.9 million doses that we had. And, the federal government and the NPHCDA, in their own wisdom, decided to give it to the first-line workers, which is a laudable feat. And that is what we have done. That is what we are doing, because some states are still vaccinating as we speak. So far, we have vaccinated nothing less than 1.2 million people out of those first batch that we received. So I think Nigeria is on the right track. What we should try to do is to get more doses of vaccines, just like you mentioned in your earlier report. And I'm sure by the time we get more doses, we'll be able to cover a lot more ground that we have covered now. So Nigeria is actually doing well in terms of vaccinating her citizenry.
All right, talk to us about the readiness of Nigerians to accept to be vaccinated. What do you hear, and how are they accepting and opening their minds to the idea of vaccination?
Well, so far, it's been a mixed reaction, really. We remember that at the inception, there was a lot of noise, a lot of brouhaha. A lot of people were skeptic. They didn't want to take the vaccines at all. And there was a lot of propaganda and a lot of rumors and false information going around as to what the vaccines do and what they do not do. But right now, I can tell you categorically that in Lagos alone, we vaccinated nothing less than 250,000 people. And if you just oppose that with the information we had on ground before we even kicked out the vaccines at all, you would doubt that we will have such a high number of people receiving the vaccines. I can tell you categorically that if we were to have vaccines right now to still give people, a lot of people will still be taking the vaccines as we speak. Because even in the past few days after we had stopped the exercise in Lagos, so many other people have called in to plead for themselves or their wards or their mother or so to be vaccinated. So yes, there was a mixed reaction at the beginning, but right now a lot more people are opening up to take the vaccines after they have seen that we, the health workers whom they thought were the guinea pigs, we took the vaccines and we are all okay.
All right, there's something that is still confusing to a lot of people. The advice is that even if you take the vaccine, you still have to wear your face mask. You still have to protect yourself. You still have to be involved in social distancing or physical distancing, as the case may be. Talk to us from that window. For someone who has been, the vaccine is meant to inoculate someone against the virus. And if you have been inoculated, why do you need to protect yourself again?
Yes, that's a very valid question. What the vaccine does is not to prevent you from getting infected. What the vaccine does is to prevent you from getting severe illness or from dying off after getting the infection. What that means is that when some people take the vaccines, they are still prone to getting infected, but the infection would not graduate to a disease which can harm them or cause serious illness for them. But it will prevent them from getting serious illness or from dying from the infection. But that's the same reason why we expect people who have taken the vaccine to still wear their masks so that they don't attract or contract the infection and then pass it on to others. It's a public health dilemma, really, and I know for sure that it is true. That's one of the reasons why some people are skeptical about it. But then again, it's not a problem because if we all take the vaccines and we achieve the herd immunity, which is about 70% to 80% that we are clamoring for, we may not need to wear our masks then because we may not be able to transmit the infection to anybody in the community anymore. So that is one of the reasons why we all need to take the vaccines when the vaccines are made available.
All right. Now, can you share with us some of the challenges so far when it comes to distributing or having access to the vaccines and bringing more into the country? What are some of the challenges that you are facing or you are seeing from your perspective?
Yes, from the field, one of the major challenges is that, as you know, the disease is rampant in some LGAs, and then some LGAs are, there are more well-to-do people there than others. So there seemed to be uneven distribution of vaccinees, people who would like to receive the vaccine. So we had a lot of people clustering at some primary health centers or general hospitals or other centers where we are vaccinating than some other centers. And because everybody wants to receive the vaccine at the same time, there is a greater demand for the vaccines compared to the supply. That was why you see in the news that some health centers, a lot of people are queuing up. A lot of people have been there since like 5 a.m. and they are not receiving vaccine or they are not being attended to on time. That story was not the same all over the states or all over the country because there are some centers that didn't even have enough people to vaccinate. So I think the uptake was a huge problem, uneven distribution of uneven demand all over the state and all over the country. That was a major problem. Another problem that we also had were some people that would naturally want to do what we call cash inducement. These are people who are ordinarily not qualified in that phase to partake from the vaccine, but they want to take it by all means. So they have a tendency of using cash to induce the health workers or whoever was the supervisor at the site, and this was not adequately reported by the reporters, and a lot of health workers were falsely accused of receiving cash to vaccinate some other people. And apart from that, also comes the problem of vaccine not being enough. Some other people would want to take the vaccine, but the vaccine were not enough for this time to go around everybody. Then apart from that, we also had the issue of people who would naturally spread rumors they have not ascertained, information they have not ascertained, information they are not sure of. They want to spread the information to discredit the program, to discredit the exercise itself. So all these were the major challenges that we faced in that phase one. And this is one of the reasons why we're coming out now. We have been coming out from the inception It's one of the reasons why we're coming out now to actually adequately educate the populace so that they know that the vaccines are actually safe. You may have one or two side effects, which may range from pain from the site of injection, which is a normal thing, and then some feverish conditions or headache. And some people also claim that they eat a lot. All these are normal side effects of the vaccine or any other vaccine for that matter. And they wear out within a couple of days. So these are things that we should all know, and then we should not discredit the exercise or even discredit the vaccine itself.
Okay. Well, enlightenment and awareness campaign is really key to this. Thank you so much for talking to us, Dr. Japhet Olugbogi, Chairman Committee on Infectious Disease, Nigeria Medical Association, Lagos, and the Medical Officer of Health for Apapa Igomu, LCDA. Thank you so much for talking to us on TVC Breakfast.
Thank you for having me.
Great.